Canadians.
Des commentaires, l'honorable député.
The Honourable Member for Mirabel. Thank you, Madam Speaker, and I would like to thank my colleague for the bill. And obviously, it's important to have a health-based approach, and that is the approach in Quebec. But you must know, Madam Speaker, that this approach cannot just be financed with good sentiments. And so I want to know whether there will be an increase in health transfers to provinces so that the Canada health transfer can cover 35% of healthcare costs in the provinces.
I appreciate the question from my colleague, and I want to thank him. He's always pushing really hard to increase the health transfers to provinces, which is so important because we know the system is underfunded. People need immediate access to treatment. They can't get that right now. The amount of money that's been spent, when we look at the comparison to COVID-19 and we look at the overdose crisis, the stigma's there. It's pretty clear. It requires significant investment, but a strategy is critical to ensuring that provincial and territorial governments are part of that conversation and are partners in delivering the protection that's needed to stop the death of people due to a poison drug supply. So I appreciate the question from my colleague, and absolutely, it needs robust investment, but it needs to also be treated fairly, and representation of 25,000 people have died from a poison drug supply in 6 years, and the stigma is clear in the amount of money the government's invested in this crisis, this health emergency.
Questions and comments. The Honourable Member for Kitchener